this conversation, which is the final in 2021 in the Children's Policy Centre webinar series in conversation with Children's Commissioners. But we will be back next year, so stay tuned for those conversations. I'm Sharon Bessell. I'm a Professor of Public Policy in the Crawford School of Public Policy at the Australian National University, and I'm Director of the Children's Policy Centre here at the ANU. I am joining you from the south of Canberra on Ngunnawal land. This land has never been ceded, and I pay my respects to Elders past, present and emerging, and I also acknowledge all First Nations peoples who might be joining us for this webinar. The Children's Policy Centre is based at the ANU and has three key objectives. First, to undertake innovative interdisciplinary research on a range of issues relating to children's policy. Second, to seek to connect researchers, policymakers and practitioners working on a range of issues to promote the human rights, the well-being and the best interests of children. And third, we aim to communicate research findings to contribute to better outcomes for children and for young people. Today, as we end our conversations for this year, we're delighted to be joined by Australia's National Children's Commissioner, Anne Hollonds. Prior to taking on the role of National Commissioner, Anne was the Director of the Australian Institute of Family Studies, and for more than 23 years, Anne has worked as an executive officer in both government and non-government organisations, including the Benevolent Society and Relationships Australia New South Wales. A focus of Anne's work across these roles and across many years has been child and family wellbeing. As a psychologist, Anne has worked extensively in the front line of practice, including on issues around child protection, domestic and family violence, mental health, child and family counselling, parenting education, family law counselling, and community development. And I should add, very importantly, that Anne has two small grandchildren, just to make sure she doesn't have too much time on her hands. Anne, welcome. It is so wonderful to have you here with us today.
Oh, thank you, Sharon. Thank you so much for having me, and congratulations on this webinar series. They've just been fabulous. What a great initiative.
Thank you so much, Anne. We have been delighted with the way they have gone, and it has been such a privilege to talk to people like you and your colleagues across states and territories about the work that you're doing.
Before we start, I should acknowledge that I'm joining you from the lands of the Camaragal people of the Eora Nations here in the northern parts of Sydney, and I pay my respects to all of their elders, past, present and emerging, and to all the Aboriginal people joining us here today.
And perhaps we could begin with your role as National Children's Commissioner. And can you perhaps just briefly outline what that role involves?
That's such a good question, Sharon, because as people who have perhaps listened to the series so far would see that the roles of the various children's commissioners in Australia are quite different. And then my role as the National Children's Commissioner is probably a bit different to National Children's Commissioners or National Ombudsman for children in other countries. So it really does vary a great deal. So under the Act that this role is established under, my job is to monitor policy and legislation to ensure that the rights and well-being of children are protected. And that involves things like doing research, providing education, consulting with children and families, and also engaging with governments across the different jurisdictions, even though my jurisdiction is the Commonwealth level. Obviously in this country, children are an issue at many levels, and so that's part of my brief as well. And of course, talking with non-government organisations and other bodies that have some impact on the lives of children. I can write reports and submit them for tabling in Parliament. So there are a few of the things that I can do and try to do. But of course, probably it's no surprise that a lot of these functions, as they're called under the Act, are really in reality aspirational. They depend upon there being sufficient funds to be able to perform these functions, and that is a problem at the moment. So the work that I do has to be done in collaboration with either government departments, academic institutions, non-government organisations or philanthropy or just through pro bono assistance. That's the reality of the role. And I think many child advocates might actually be quite surprised in a way, because there was a lot of lobbying for this position, I know, before Megan Mitchell took it on in 2013 as the first National Children's Commissioner in Australia. And we were all really pleased to see that role established. And probably it's been a bit of a shock to me to see how the money has really become quite insufficient for the functions over time.
I mean, and it's a broad role that you play, and I think, you know, we'd probably all see that you've also been incredibly active in the media and in engaging in and leading public debates, and of course all of that does take resources.
Well, it does, and there are, as you can imagine, Sharon, every day there are issues that I'm contacted about, or that sort of I come face to face with that really need work to address. And I can't, you know, all I can do is keep a watching brief over many of these issues, and then try to assist and contribute to advancing children's interests in that area, you know, if possible. And but you know, it's interesting when I reflect on that a lot of the issues that come up are actually symptoms of deeper problems at the core of our, you know, the way that we run this country. Frankly, and that's that system reform that really I see as my brief, where I can make the best contribution, is not to be sort of tackling all the different issues all the time, although I know that there are some stakeholders who wonder sometimes, why isn't she speaking up on this or that issue? But as I said, many of them are symptoms of some underlying issues, and so I'm really trying to work assertively but constructively with various governments to try to achieve that kind of system reform that will ultimately lead to better outcomes for kids.
And so, Anne, one of the things that we particularly want to talk about today is the kind of society, the kinds of policy supports and opportunities that we want to have for children in this country over the next decade, perhaps thinking a little bit about those systems reforms, particularly as we grapple with the legacy of COVID-19 and we move forward. And after you and I have had a chat for really half an hour, 40 minutes, we'll open the conversation to others who might want to ask questions as well. But let's begin by thinking about the pre-COVID situation for children in Australia. And this is such a complex question. You know, when I reflect on this, in so many ways, Australia is a really wonderful place to be a child and to grow up, but it's not an equal place. And the research that I've done, the work that we do here at the Children's Policy Centre, focuses on the deep poverty and inequality and lack of opportunity that some children face. And we know some systems are not working. You've already talked about systems reform. You know, from your perspective, Anne, how well were children doing before COVID hit?
Well, from a data perspective, I guess the figures that are quoted are that 80% were doing probably okay that day and 20% were not. But of course, the issue with the broken systems is that, you know, a family might be well able to support the safety and well-being of their children today, but tomorrow things might change. And I think that's actually what COVID really amplified, was the additional stress on families without the supportive infrastructure to empower parents to care for their children well, really left a lot of kids out in the cold. And so I think these system problems were pre-existing, and frankly, we've had very little traction in getting them changed. I mean, I'm speaking as someone now who, you know, I've spent decades in this field of child and family wellbeing, and you know, when I look back to my early days as a frontline child protection worker, I can honestly say that actually, in substance, very little has changed. We're already, you know, we're seeing more and more kids removed, and of course disproportionately First Nations children. But at a high level, we know that there are indicators like the fact that Australia ranks 32nd out of 38 OECD countries on child wellbeing. And these are the sorts of indicators that would really go to, you know, is Australia the best place in the world to raise a child and the best place in the world to be a child? And we're not, we're clearly not. We're 32nd out of 38. That's one indicator that's quite important. So there is a big gap there between, I think, even the aspirations of, if you like, well-resourced families have aspirations that can't be met. Things like the fact that we don't have equal paid parental leave for both parents, that childcare, access to childcare is still really, really difficult. There are these sorts of issues, often called women's issues, but they are issues for children as well, because what is happening for the parents impacts on the kids, but also things like having time with your parent when you're an infant is really important for a child's well-being and development. But also access to high quality early childhood education is important for children. So that's where I guess we're not always used to talking about these things as children's issues, but we see them as women's issues, but they are actually children's issues. I guess the other thing I would say in terms of your question about what was it like for kids before COVID is just to sort of, I sort of see that the whole care and protection spectrum, from domestic and family violence and child abuse and neglect, which I put in the same sort of group at one end, all the way through to perhaps youth crime at the other end, and everything in between. These are all care and protection concerns where I think the systems are broken, where we need to do a lot of work. And whilst there might be some children who are more likely to be at risk because of intergenerationally, their family circumstances, there is also a group of children who, as I said earlier, might be fine one day but not fine the next. And so we do need far more responsive and early intervention mechanisms to be able to support families and to respond to the needs of children much, much better.
And, I think that's such an important point that you make about us just not thinking about children well enough, deeply enough in policy. And, you raised the issue of childcare, which so often is presented as a women's issue, but also in Australia often just as a productivity issue. We're not thinking about that from a child's perspective, and we never think about children in policies where we don't see a place for children. Whereas you talk about time with parents, employment policy, labour market policy becomes central there, but we never think of children.
Well, that's exactly right. And I've often said that there is no area of domestic policy that doesn't impact on children and the families trying to raise them. And recently there was some research done in the US, which has relevance here, I believe, which sort of really highlighted that ordinary people, when interviewed, don't make that link between children and policy. Economic policy or employment policy, or even things like public transport policy. And yet when you talk to kids, they'll say how those things are important to them, right? So kids are very articulate if we ask them. They will tell you how important these things are. But I think as a general public, we're not accustomed to it. We kind of assume that their kids are an appendage of the adults and usually the women, and they're not relevant at a policy level. And that's one reason why I've really seen during this year that I've been in this job is that children are not a national policy priority in this country. And a lot of the things, the bad things that happen, and we'll probably mention a few more of them before we finish today, they're a result of that. The fact that there is no national leadership for children to be a national policy priority, and it is typically adults' issues, adults' concerns that take centre stage.
Yeah, absolutely. And I guess when we think about some of those particular challenges that face children, those issues where we do think about children, we've got something like 11 national plans that affect children in Australia. The National Framework for Protecting Australia's Children, which is just being renewed, is one of them. The National Plan for Reducing Violence Against Women and Children, another national strategy to prevent and respond to child sexual abuse. Those three in particular are important for children, but all of those plans relate to children in one way or another. How are children positioned in some of those plans? And what have you seen, Anne, in terms of the extent to which children have been consulted in the development of any of those national plans?
Well, look, you know, there's an eye-watering amount of work being done at the moment with all these plans in development or the, you know, launched and the implementation plans being developed. And that's just at the national level. We're not even talking about at the state and territory jurisdictions. So it is a very complex policy environment. And in relation to the engagement of children in the design of those plans, it's very patchy. And there is really no systematic engagement of the experiences and insights of children and young people on these policies that are designed to be helping them. It's, you know, happens in bits. And I guess one of the positives, I like to give credit where it's due, is that there is more of that now than there was maybe 10 years ago. There's certainly more awareness of the need to do this. But we've still got a long way to go. But it was pleasing with the National Framework for Protecting Australia's Children, which is, you know, we've just finished the 12 years of the old plan and the new one is under development now, that the community services ministers who do this collectively, so the community services ministers in every state and territory and the senior ministers at Commonwealth level, Minister Anne Ruston, they all agreed that children and young people should be consulted, and not just as a one-off at the beginning, but in an ongoing way. And so that is now built into that framework. And I think that's a first at that national level for that to be built in a systematic way. And that certainly I'm seeing as a green shoot or a positive indicator of change. And I was really pleased to be asked to do those targeted consultations during this year to inform the first implementation plan.
And I'm keen to hear what you heard through those consultations and what issues children raised. But perhaps first you could just give us a little bit of insight into how those consultations took place, you know, the way in which you were able to consult with children, and the extent to which you were able to reach children who often don't have the opportunity to have their say, you know, for whom something like the framework is particularly important.
Yeah, that's a really good question as well, Sharon, because often when we talk about engaging with kids, when you look into what the mechanism is, it's often a sort of a youth ambassadors group, or, you know, at a school level, it might be school prefects, or, you know, it's at a fairly, I guess, elite level. And there is absolutely a place for that, where they represent the voices of other young people involved in those various arenas. But the kids who often don't get a go, if you like, are the ones that are targeted by this framework. And so these consultations were specifically designed to reach those kids who, as I often say, the ones who may not have had breakfast that morning. And then they're harder to reach, obviously, but we were really lucky to find some fabulous local service providers right around the country who every single day are supporting these kids, and in a variety of different ways, and supporting families as well. And they were able to convene for us groups of kids and families that we could talk with directly. And it was one of the most powerful experiences of my career, I would have to say. You know, as you've outlined, I started out in the front line, but it's been a long time since I've had that opportunity, and it was really such a privilege to hear firsthand the stories of these young people, and some of them were young people who were already parents with young children. So, you know, there's an important crossover there. And so, so I'm very grateful to all of those service providers, if any of them are listening, to the help that they provided for us to be able to reach these kids.
And how are the ongoing consultations going to take place? You know, you pointed to that important part of the framework moving forward. How's that going to happen, and what kind of mechanisms are in place to ensure that over time those consultations continue?
Well, that hasn't been designed as yet. So we're just basically the governments are working on the first implementation plan based on what they've heard so far. But part of it is about looking at what the kids said is useful to them. And it was really interesting. There was a lot said about authentic discussions like the ones that I was able to have. I mean, it seemed to be valuable to them that the National Children's Commissioner was there and was there to amplify their voices to government. And I was able to ask them, you know, what was the message that they wanted to give to the Prime Minister, if there was a message they wanted, you know, like it was a way of a channeling, if you like, of voices of kids. Now, that's just one way, but there may also be a place for, if you like, a regular group of kids that can be consulted in a different way, a panel or a group of some kind. So all of that's still being discussed.
And what kinds of issues did children and young people raise?
Well, it was so interesting to me. So just to track back a bit, so this is the framework for protecting Australia's children. We targeted the four priority groups, which were in First Nations children and their families, kids with disabilities, and parents with disabilities, kids in out-of-home care and leaving care, and also complex kids and their families with complex needs. So there were the four that the ministers had decided were the four priority groups. And we asked them really two questions. One was, what is it that keeps you safe and well, or what is it that keeps kids safe and well? Or if it was an adult, what helps you to keep your kids safe and well? Who or what? What are the services? Who are the people? And then, you know, to understand a little bit about why, what was it about them that helped them? And on the other hand, what gets in the way? What are the gaps? What are the barriers, the challenges? In other words, what needs to change in order for children in this country to be safe and well? So we're very broad. And in response to those broad questions, it was remarkable how similar the messages were across the country. And they fell into a few different groups. And I'll just highlight a few of the key themes. One was about violence in the lives of these kids, violence in the home, violence in the streets, in the neighbourhood, and violence in the schools. So for many of these kids, school is not a safe place to be. And I found that quite shocking, actually. We heard a lot about not being able to get the basics, if you like, we called it the basic living conditions in the report, like sufficient income and secure housing, for example. And housing was a massive issue. And this was, again, right across the country. I don't know, there wouldn't have been a place where this didn't come up. And I think it may have been amplified by COVID, because we know rentals have gone up everywhere in outer urban areas and regional areas. But it was a pre-existing problem. And probably I'm still haunted most by the young parents I met, young women, who their stories would often be that they had left a violent relationship, ended up homeless, ended up couch surfing, or in a caravan park, or in a short stay refuge with a baby or toddler in tow. And Sharon, I met them everywhere. And it was absolutely heartbreaking to see, I mean, how, really I had to sort of ask myself, how can we expect these kids who are now parents to keep themselves safe as well as keep their own kids safe if we can't provide housing for them?
Yeah.
It is a massive, massive problem. This will be no surprise to many of the frontline workers who are listening. We heard a lot about schools, and schools are in many areas they're the hub of the community in a lot of ways. They may be possibly the only thing in the community in some of the places we visited. But for some of the kids that we were talking to, school was not a welcoming place for them. I've already mentioned that some of them talked about violence in the schools, but they also talked about discrimination, about judgment, about not feeling welcome. They felt that teachers needed more support and more training, but for themselves, they felt alienated. And that's why they hung out on the streets, right? They just did not get that connection to school. And, I thought that was such a missed opportunity. And I have begun discussions with education departments about this issue, because I hadn't before these consultations realised the real significance of what schools could provide in these areas where there's not much else. And I think there is an opportunity to really try to integrate a lot more services in with the schools, but also for this design of the schooling to be much more embracing of families and children in a holistic way, so that they are comfortable and places that kids can go where they feel they're going to be respected and trusted. This is the sort of thing kids talked about. They could tell me exactly who they trusted and who they didn't. And unfortunately, often the people they didn't trust were in the schools. Sometimes they were the service providers, but then there were other service providers that they said, yes, I can trust that person. And when I would ask them why, they'd say, because he or she understands me. For First Nations kids, obviously, they often came from a similar background. They understand me, they don't judge me, and they treat me with respect. It was so clear, and it's not a lot to ask of the services, but in a sense, but it does mean that the systems we have out there are not supporting the kind of frontline service delivery that might actually help change lives everywhere. We found many, many places where they were, but there are big gaps in the landscape out there.
And it's so interesting to hear that. And we have heard over time very similar things from children and young people in the research that we've done. And of course, we have some really significant examples of schools being used as community hubs and as places that can bring people together, but also be a place where people can connect to services. But that doesn't work unless families and children have trust in the schools and feel comfortable. And I'll never forget a comment that a principal once made to me in a particularly low income and disadvantaged area, where he said, the challenge they have is that for so many of the parents in the school, the last time they sat in the principal's office was when they were being expelled or told that they weren't wanted. And so for those parents to connect is incredibly difficult. And I think the other part of this, Anne, is if we expect schools to play that role, we need to support and resource schools and teachers.
Absolutely.
They can't pick up on what the rest of society can't manage to do.
No, absolutely. And I'm very quick to acknowledge we cannot ask teachers to do more than what they're already doing, but we do need to support them in their work better. And there's lots of opportunities to layer on other things through the school. And look, if I look at some of the Scandinavian countries that I'm familiar with that have, in a lot of ways, I guess I would say more sophisticated child wellbeing policies, they have historically always connected health and education together. There is an integrated model that really does see the child more than just as a student, but as a whole person with hopefully a family that really can be helped much earlier through that universal platform, rather than waiting for things to escalate to some kind of crisis.
Yeah. And I'm thinking about, those young mums that you talked about who are trying to keep both themselves and their children safe, while often not having secure housing, facing a whole range of other challenges. And the issues that those young women, like many children and young people, face go across a whole range of policy portfolios and policy departments. And this is often one of the real challenges. What are your thoughts on how we move beyond those silos and start to join the dots?
Oh, I wish I had a magic wand for that one. Look, I think I'm seeing greater recognition of the problem. And, the National Framework, for example, talks about the complexity of the lives of these kids and their families. By the way, unfortunately, their complexity is compounded by the complexity and the lack and the fragmentation and lack of coordination in the service system. So currently, we're not able to help them. And I think it's got to be by not just requiring at the front line better coordination and integration. And as I said, there's already great examples of that. But often those frontline service leaders, I used to be one of them a while back, often they're battling the hierarchy above them. I recall my own stories. I recall running child and family centres in Queensland, and brand new ones set up by the Department of Education there. And, we were able to layer in a lot of different services for the families, but it took an extremely long time. Actually, it took several years to get agreement from the health department to actually place the maternal and child nurse in those facilities, and families were still required to travel to another location. That was a while ago now, and I think things have really moved on in many places, but we need more of that, and it needs to be supported by the heads of those departments, that the authorising environment for sensible integration needs to be there. But I think there also needs to be potentially some legislative requirements, and I might say a bit more about that in terms of my vision for the future. But I think until there is some accountability to integrate across portfolios, then we are really just leaving it up to the leaders that are there of the day. But look, I think over time we're inching our way forward. In any case, it's just not going fast enough.
So, Anne, let's talk a little bit more about what happened over the last couple of years. Children were largely overlooked in policy making during the pandemic. Here at the Children's Policy Centre, we undertook a child-centred analysis of the most recent federal budget. And children as citizens and as social actors were largely missing from that budget, along the lines that we've already talked about, perhaps in relation to childcare, but that was often a women's or a gender or workforce issue. Thinking about what happened during COVID and then looking forward, what can we learn from what was effectively, I would suggest, the neglect of children in policy making during COVID, or in COVID policy making? And how can we take those learnings forward and do things differently?
Well, I think we have to recognise the outcomes of having overlooked children, and the data is coming in thick and fast in terms of the serious mental health issues that we know about, even at very, very young ages now. Presentations of suicide ideation, self-harm and eating disorders and so forth at emergency departments has been really critical in those places like New South Wales and Victoria where there's been extended lockdowns. And of course, we're still to see, after the second series of lockdowns now, the evidence of the shadow pandemic, the impacts of domestic and family violence and child abuse and neglect, which we expect to spike again now that children are more visible. We certainly saw it last year in 2020. And I think, so, you know, what we've learnt, so we need to recognise there are these impacts. Then we've got to take steps to correct what's happened. We've got to help those struggling children who missed out because they didn't have parents who could help them with homeschooling, or they didn't have devices at home that they could use, or they missed out because we failed to recognise that schools are much more than about academic learning that can be replaced by Zoom anyway. That schools are a social learning environment for the development of social and emotional skills such as self-regulation and language and so on. And as we've just talked about, schools are a hub of support for kids and families. So by keeping schools closed for so long, in order to protect adults, which is now we understand that's why it was being done, that actually it was about, it wasn't primarily for the children, but it also was overlooking the fact that children had a range of needs that were not being met, and children's needs are unique. So we've got to really understand why we missed the boat on that, and correct it. And so, you know, one of the things we need to do is to really look at next time round, if there's an emergency, we need to act differently, but I think we need to act differently anyway. And the reason children were able to be overlooked, in my view, is that there was no one at that cabinet table representing them, or at the, those meetings of senior health officials who would speak up for children and their unique and diverse needs. They just weren't there. So we need to at least do that, but we also should be talking with kids along the way and checking in with them. I mean, UNICEF put out some research recently about large numbers of secondary students who were never even asked by their teachers in Zoom calls, how are you going during the lockdown? So again, there's just so much more we could be doing to ensure that kids are not overlooked in the future.
And we'll open up to invite people to ask questions if they would like to in just a moment. So to the people who have joined us on this webinar, if you would have a question, please do put it in the Q&A. Either type your question or just put that you would like to ask a question, and I will unmute you so you can ask yourself. But Anne, you made that really important point that during COVID, children didn't have a representative at the table at National Cabinet or in a range of other decision-making bodies. What kind of role do you think we need established in Australia, perhaps thinking particularly at the federal level, to ensure that children are represented, not just in times of crisis, but across all decision-making?
Well, I think at the very least what we need, Sharon, is a minister who has a clear responsibility for children in their title at cabinet level. So that's at minimum. But what I'd really like to see is what's been done recently in relation to women's safety issues, where there's now several ministers at cabinet level who have responsibility for women's safety and economic security, and they together form a women's safety task force, which goes to the point we were just discussing about the fact that these issues don't live in one silo. So women's issues don't live in one silo, but neither do children's. So it's not enough just to have one minister who's looking out for children. It's all the ministers who have a primary responsibility for children as part of their portfolio should, I believe, be working together in a task force and really facilitating that kind of cross-portfolio collaboration at the top, which would support it to be happening in the policy context and then at the front line of service delivery.
And we've got a question in the Q&A from Tony Wren. Tony asks, can I ask both of you to comment on how we can get all political parties to address the shockingly high level of child poverty now and likely to sadly increase post-pandemic? I'm happy to provide some thoughts on that, but Anne, would you like to?
No, you start. Give me a minute to think. You start, Sharon. Tony always asks the hardest questions.
Yeah, she does, and she sometimes has the answers herself, so I might just unmute Tony at some point.
Yeah, Tony, tell us.
Look, I think from the work that we're doing, there are a couple of immediate things that would help to address very high levels of child poverty. And then there are longer term strategies that we need to have in place. And I think around the immediate things, we had what was essentially a phenomenal social experiment last year and during the pandemic, when we saw an increase to working age benefits in Australia. And we know what happened. We know that many, many thousands of children were lifted out of poverty in Australia. We know from some of the research that's been done by a number of individuals and organisations, including my colleague Elise Klein here at the ANU, that money was what we might say spent well. You know, there's always this concern that if you raise working age benefits, how will people spend it? Well, we've got the evidence now to show that people bought food, they paid for medical care, they saved, they bought the essential things that they'd not been able to buy, and they often paid off debt. So I think working age benefits is critical for us to think about. And you've already raised the issue of housing. You know, this is a crisis in Australia that impacts on children every day, and we need first and foremost to increase the stock of social housing in Australia in this context of unaffordable rents. And the other thing that I would add to that is that we need to look at minimum wages and precarious work, because we have not seen increases to wages in Australia for a very long time. Wages are not keeping pace with CPI, certainly not keeping pace with rents. And so in terms of income poverty, they're the things that we need to address urgently. I think we also need to think in Australia about the way in which poverty impacts on children's opportunity, on their ability to participate in education, but a range of other things, and how it impacts on relationships and how we can build a commitment to supporting children and not abandoning families to their own poverty. And it needs to be an election issue as we approach an election. Anne, over to you.
Well, look,
too long an answer from me.
Your work, Sharon, on the sort of ways that poverty impacts on children and how they see it from their eyes is just so compelling, and has been a big influence on me. But, you know, I guess it's the question of how do you get anyone else to sort of stand in the shoes of those kids, and maybe we just need to do more of amplifying their voices, you know, in the way that you've already done with that research. I think what I agree with all the points that you made, and I think it really highlights that earlier comment we made about the intersection between social and economic policy. That sort of economic policy does matter to kids, and that's where, you know, women's income security, for example, and housing security, because we know they're still the primary carers, has a big impact on children. So I am a big supporter of advancing, you know, women's issues, if you like, because it has impacts on children. But we also need to talk about the children. And so, you know, I guess this is the thing I've been sort of watching developments over the last year in particular. And, you know, I guess there's, you know, you can see how when an issue becomes a big political issue, like the women's issues have become this year, clearly this will be an election issue, with its hence the, you know, recent announcements about the Domestic and Family Violence Commission and the funding in that area. So there is money. It is not a matter of there's no money to fix these problems. It is all about priorities. And so I think together we need to try and make children a national policy priority. We just have to, because if they're not, then the pressure will not be there to make the changes. And I think some of your research and that of others has been really interesting. And one that stood out for me was the Melbourne Institute's paper that showed that even living in poverty 1 year in your childhood has a negative impact in terms of your later life outcomes and increases your likelihood to be in poverty as an adult. just 1 year. And so, you know, somehow we've just got to increase the pressure on both parties, frankly. This is not a, you know, this is a bipartisan issue, and we need a bipartisan agreement that it is not good for kids or for any of us to allow these children to be in poverty in these really, really, you know, really, really important childhood years. That their ability to recover from that is limited because of the fact that they're developing so fast. Their needs are unique, and their needs are very demanding of us to be able to support their parents to keep them safe and well.
And I think that point you make about this needing to be a cross-party issue where there is bipartisan or multi-party support for supporting children, and particularly for addressing child poverty in this wealthy country, is so fundamentally important. This should not be a political football from which points can be scored. This has to be an issue where we put children's rights, well-being, interests at the forefront for now and for the future of the country.
That's right. And look, sadly, we're still in an environment where policymakers often think in terms of new programs. Let's have a new program that helps kids or helps their parents, parenting classes or something. And, you know, without recognising that it is the fundamentals that matter. And I guess that's what the consultations this year I did from the voices of the kids and their families themselves said it is the basics. Sorry, you can't skirt around that. We have to address the basics. It's the fundamentals do matter. Housing and income security do matter. Whether there's public transport matters. You know, or you know, access to health services matters. And it isn't a matter of a shiny new program that someone thinks up that's going to, you know, do something special. We should be investing in strengthening those universal platforms.
And we have another question in the chat from Angie Bexley, who says, you mentioned lessons from Scandinavia. And Angie asks, are there other countries or commissioners' work that Australia can learn from, is generally and particularly in the context of this conversation where we're having right at the moment about placing children at the centre?
Well, yes, certainly I'm trying to learn from some of these other countries, and the Scandinavian countries are a standout. Obviously, you spoke with Bruce Adamson about Scotland. New Zealand's doing some interesting things. So I'm trying to find examples wherever I can to be able to show the decision makers that it doesn't have to be the way it is now. I think that's the part of the problem in Australia. We are a long way away. We do think we're special and we can't do the things that other countries are doing. And particularly during COVID, we've become quite isolated, I think, and quite parochial. So, you know, even things like with the Raising the Age campaign, you know, to be able to demonstrate that many other countries have raised the age of criminal responsibility and the world hasn't fallen in, and they've done it through very carefully designed welfare approaches that really look at the care and protection issues I was mentioning before, seeing the kids who end up doing crime as being part of that spectrum and in need of our care and protection. So those sorts of conversations are being had, but you know, I think that there just needs to be more community understanding of this as well. And just on the Raising the Age issue, you know, I just really one of the things that upsets me the most is that we struggle to find political leaders who have the courage to stand up and say, yes, you know, we know everyone worries about law and order. You know, they're asking for us to be tough on crime, but this does not work. The evidence shows that locking up children doesn't help. It, in fact, makes the problem worse because we're growing adult criminals by locking up children. We just need someone with the courage at the political level to say that and to start to be part of educating the community. You know, and it's not enough, you know, like I get my chances in the media. I must have talked to Patricia Carvallis about this issue half a dozen times in recent months. And that's not enough, right? It's got to be much more mainstream in the conversation. We need to explain to the public that currently we're wasting their money by locking up children.
And what were your thoughts on this issue was raised again at a really recent meeting of Attorneys General. We've had the ACT committing to raising the age now and to moving forward on that. What was your takeaway from those most recent discussions on this issue of minimum age for criminal responsibility?
Well, you know, when I looked at the statement out of the meeting of Attorney Generals, the MAG meeting, I was really disappointed to see there was all, you know, a lot of other matters were dealt with, and then right at the bottom in sort of other business, which was dealt with informally, was this statement that the 6 states would wanted to have a, you know, investigation of a proposal. I've called it a plan for a plan. So there was actually no commitment made, and it was only to the age of 12. And like, you've got to ask, well, where's the evidence that that's the right age? What's that based on? And that report in the ACT, I thought, did a fabulous job of really laying out the issues and even explaining how this could be explained to the public, right? Because everyone knows it's an issue of explaining to a public audience. So it was very disappointing, and so along with my Children's Commissioner colleagues right across the country, we put together a media release and went public on the fact that we were not happy about this, and really no one is happy. No one who, none of the experts, no one who has thought about this issue for more than 30 seconds would argue this is the right way to go. It's extremely disappointing, and I'm hoping that there is still an opportunity to encourage them to take it further and to follow the lead of the ACT, really, which based on that report that was done, really there's a lot there that they should be looking at, in my view.
And we're getting towards the end of this conversation, although I could talk to you for much, much longer. But I wanted to go back to this issue of thinking about, as we move out of COVID, or at least learn how we deal with COVID and move beyond lockdowns, perhaps is a better way of putting it. We do have an opportunity to think deeply about the kind of society that we want. From your point of view, what should children's place be in that society? I mean, this goes to this point that you raise about convincing people that 10 is too young to incarcerate children. You know, how do we think about children's place in society? But then perhaps how do we think about the policies and policy levers that we can use to get there? Big question, I know.
So if you're wanting me to cast forward now.
Yeah.
Well, look, I think COVID, the disruption of COVID, we need to use to show things can be done that we never thought could be done, like raise children out of poverty, as you were saying earlier. Amazing things were done during COVID that in a positive sense for people. So we should not now settle back and go, oh, it can't be done. Actually, it can be done. And I think, this point has been made well by others, such as Tony in her National Press Club speech. So absolutely, we should keep the pressure on. And we should now plan for what's, I guess, known internationally as the post-COVID decade in terms of child wellbeing. So we've got to actually address the needs of those struggling children who have missed out and have suffered because they were overlooked in the COVID period. And we need to help them, just like we helped struggling businesses with Extra. Over this time, we need to be helping struggling children. What I hope to be doing, I've already started, is to develop a child impact tool, assessment tool, where we're going to look at the emergency measures that were brought in, or some of them at least. I think there was about 600 different pieces of legislation. I'm not going to be looking at them all, but looking at some at the national level, and my colleague Liana Buchanan is going to be looking at some of them at the Victorian level, to then highlight where the missteps were, in the processes and what the outcomes have been for children, so that we have on record evidence that says this should not be happening again. But beyond COVID impacts itself, I think this is a real chance to now lay the groundwork for something much bigger and very, very important. And if I was to think of, and I have thought about, well, where would I want things to be in the future, let's say in the next 10 years or so, I would want to see evidence that children are a national policy priority. And there may be a variety of ways that we would see that. So there's just four that I'll mention. One is that, these are some of the things I've already mentioned before, but one is that we would have an overarching national wellbeing strategy for children that would go above all of those disparate silo strategies and would bring them together in a more holistic way, and that this and highlight the horizontal sort of connections between the two. I mean, I spend half of my time bouncing from silo to silo, asking people to talk to each other. That we need to kind of really make that a systematic thing, and to make clear the accountabilities clear, to make and therefore to be outcome measures built in, and all of this needs to be supported by legislation. So I am of the view that a lot of this incremental reform, it goes at a snail's pace because there is no legislative accountability to support it. So I would be going for that. I've already said I want a cabinet minister for children and a cross-portfolio task force of ministers responsible for children. And I think we need to see evidence that things are getting better, that we're seeing a significant reduction in child poverty, for example, that we're seeing child safety and wellbeing and development indicators improve. So we'll be wanting to see that in 10 years. And I also want to add that I think, and I hope it won't take 10 years for this, but that we will have a systematic way of engaging with children and young people for all policy design and policy monitoring of policy implementation, that we build in Australian mechanisms to do this. It might not be the same thing as is happening in Scotland or somewhere else, but I think we can build our own of a world-class standard and have it bedded in a cross-government sort of way that this is how we do business here. This is the business of government, and hearing from kids is part of the business of government, and we have this enduring mechanism that does this well.
And this has been a fantastic conversation. I've so enjoyed hearing your views on this range of issues. I think those 4 points are the perfect place for us to end this particular webinar. And if we could indeed put those 4 points in place, we would see children much better placed in our society in 10 years' time, or perhaps in 5, preferably.
Preferably, that would be.
I feel, Anne, we've only just scratched the surface of the work that you're doing today, and we'd love to have you return next year to continue the conversation. But for today, thank you so much for your time. It's been such a privilege.
Thank you, Sharon, and it's been a delight to chat with you. Thank you.
And a reminder to everyone that all of the conversations in this webinar series are available on our website. This is the last of our conversations for 2021, but we'll be back in February of next year. First off the rank next year will be a conversation with Zoe Robinson, the Advocate for Children and Young People in New South Wales. So please do keep an eye on our website for the details and join us again then. And if you haven't already, you might want to subscribe to our newsletters so that you get the updates of our events and of research. The past 2 years have been difficult and devastatingly so for some, and we hope that 2022 brings better things, and that it's a year when we seriously address some of the challenges we have to ensure that all children in Australia have the material basics met, have the opportunities they need and deserve, and have strong and supportive relationships as they grow up. I would like to thank my colleagues at the Children's Policy Centre, Celia Vukovic and Angie Bexley, for the amazing work that they've done this year in making this webinar series happen. And I'd especially like to thank the commissioners from across Australia and beyond for sharing their time, their wisdom and their expertise during this series. And Anne, it has been such a pleasure to have you give be part of this capstone conversation as we close off the year, and thank you for the work that you do. Thanks to all of those who have joined these conversations, and we look forward to seeing you all again in 2022. Thank you.